It is the nastiest, rainiest day. I probably look like a drowned rat, but I just pulled into Meridian Plastic Surgeons and let's do this. We have to go around the roundabout. Sneeze really loud. Do it. Do it. So we have to go around the roundabouts in order to, bless you, cross the street. I'm getting so nervous for my surgery. Mark thinks I shouldn't be nervous. Hi guys, so welcome back to the channel. So I'm here with Dr. Christine Kelley, the amazing, legendary Dr. Christine Kelley. And today we're talking about implants. So we're gonna answer just a couple of your questions. And Christine, I mean, she's part of a new research that's gonna be going in and talking about breast implant illness. And we're very grateful for you, Christine. So thank you for taking the time to do this video for us. So we had a couple questions. The first one was, are people having issues with other types of silicone, like chin implants, butt implants, or is it just the breast implants?
That's a good question. It's an interesting question. I've only been approached by one person who thought that they might be having issues. I don't have nearly the expertise at removing implants in other body areas. We referred them on to a surgeon who has more expertise and does not only insert them but removes them on a regular basis. There are patients with orthopedic implants that are reporting similar symptoms. I'm very much aware of that. So I think it's certainly conceivable. These are similar materials from the perspective of, if we look at this as an idea that any medical implant can potentially chronically stimulate the immune system into a persistent cycle of autoimmune reactivity and subsequently autoimmune disease, then I think it's certainly conceivable, and I'm aware of reports. I just don't have personal experience managing those patients.
Okay. I mean, it would make sense in my mind, if you have any issues with things like that, to go see your physician. We did talk about on my channel about seeing a doctor who listens to you. I know Christine was the first one that I saw that I absolutely felt comfortable and safe with. What advice would you have for people who have gone to a doctor and the doctor has shut them down? Would you say just keep going to find another physician, or would it be wise to travel to come see you? Like, what's kind of your thoughts on, you know, finding the right surgeon for you?
I think word of mouth is going to be your best method. Learning from other women, and I know in the BII community that is communicated pretty well. They've already had the experiences, both negative and positive. I think it's not likely, unless you have a very special relationship with your original surgeon or a surgeon that you visited that has given you pushback, it's not likely that you're going to be able to change their mind at this point. I think that's going to have to come from us. We have to get buy-in from our leadership, and then it will come from the top down. I think it is difficult for patients to convince someone who's skeptical.
Makes sense. What's the number one symptom that women that you tend to see come? I know we just talked about this. I wish we had this on camera earlier.
I think what I have people reporting to me almost every single time is severe fatigue that is the worst fatigue they've ever experienced. It defies explanation, and it really is debilitating, both in terms of childcare, spousal interactions, work activities. It really starts to have an impact on daily life.
But Christine and I were just talking about how I actually didn't feel better immediately after. I had some symptoms go away immediately after my explant, and she did a fantastic job. But like, my body had a lot of damage to it, not just from breast implant illness, but we were talking about how a lot of women will jump off the table and feel better, and then the other ones who don't feel better right away, they can become discouraged. And yes. Have you seen that? Like, how do you suggest kind of dealing with that, because it's a heavy emotional thing to have your implants removed and to go through a surgery, and then afterwards, you know, it's amazing when you feel better, and it's amazing. I felt like I had a weight lift off my chest and I could breathe for the first time in years, but there were some things that lingered, which definitely needed time to come out and work themselves out, because we didn't get sick overnight.
No.
And it takes time to kind of unravel that. Thank God we don't get sick overnight. But how would you suggest kind of navigating that for the ones who feel better right away and for the ones who don't feel better right away? Like, do you have any suggestions on?
Well, the ones that feel
or
better,
words of encouragement?
The ones that feel better right away, it's an interesting phenomenon to me. I wonder a little bit if they are experiencing some anti-inflammatory effect, because I do use anti-inflammatories for pain management. But many of those women actually will persist through and continue to improve without any backtracking over the ensuing weeks to months, and will often report being very close back to themselves within 3 to 4 months. I suspect those patients aren't as severely affected, or haven't been as affected as long. And so I think, much as you described your own experience, Cecilia, patients need to understand that there's a spectrum of presentation, there's a spectrum of severity. And for the patients that have more severe involvement, have had their implants in longer, it is going to take longer. Understanding, being patient. And I don't routinely use detox. One of my rationales is that, at least for the first few months, I would really like to isolate the effect of the implant removal, and make sure that that is the only variable that we're evaluating. But I think for women that are still feeling poorly at 3 to 4 months, we have to understand that there can be system-wide abnormalities created by this problem, and maybe then consulting with someone with expertise in detox can help you break through and get over it. I think really that's pretty much what you've described as your experience. You researched it yourself, as I understand it, more than getting professional assistance, but you were able to use the knowledge and techniques that you gained to break through and get to a point where you feel very, very good.
Well, and I felt great before I started doing the infrared sauna, and I think that really exacerbated everything when I had my implants in. And so I think there are different degrees, because with all that heat on the implants, I'm sure it was just, you know, cooking everything inside my body. And so I know that I was coming from a place of being severely ill at that point, like neurological issues and all of that. Some women, it's just inflammatory, like their joints hurt and all of that. So there's different degrees that people, and different symptoms people have. And I think that anti-inflammatory is huge, because when you get them taken out, your body can kind of function. And like we were talking about the bucket theory, where it's kind of like you're putting this inside the bucket and it's filling up the bucket, and there's not much room for anything else. So there's not much room for food sensitivities. There's not much room for environmental toxicity or mold toxicity or whatever else may.
Adverse effects of other medications that you take, work and family stress that maybe leads to poor sleep habits in and of itself. So exactly, I think the threshold concept, different individuals having different thresholds, sometimes lower, sometimes higher, but I think that removing, so along those lines, removing the implant may not completely cure all of your symptoms, because you may still be very, very sensitive to other things that are happening to you in your environment. And continuing to try to be a detective, figure that out, and addressing them can, I think, help get you to your goal of feeling better.
I agree. And our last question is, what are you most excited about learning in this study that you're going to embark? I think it's just amazing, like, that you're going through this. And I was just telling Christine, she's so brave for, you know, stepping out on a limb for women's health. What is the most, like, what are you looking to find that you're going to be so excited? Like, what just excites you about this?
Well, I am going into this with an open mind. What excites me is the interest of someone else who has a research background, who is also really going out on a limb, because the nature of medical research today is that you need to produce results. to justify the funding that you've received. So I'm so glad to have that partnership, first of all. And secondly, I'm going into it hopefully with the mind of a scientist, meaning that I'm okay if we have a negative answer, that bacteria and fungus in the implant environment are not responsible for these symptoms in some degree of women. But at least we know that, and we can start looking elsewhere. I would like to have parallel research projects going on as well, where we look at things like metal and other chemical toxicities, because I certainly have concern that that is part of the problem for many women. But at least I've been able to connect with one person who's going to help me evaluate our bacterial and fungal biofilm colonizations in these implant pockets, likely to be responsible or not.
That is so exciting. That's amazing. So what does the future look like for like the research? Do you think that's going to branch off and start, like you said, doing parallel research? And do you see yourself as?
I sure hope so. I'm not very good at networking and connecting, because I am very much an introvert and I'm a technician. I just do the work, but I'm certainly willing, with assistance, if anyone can bring people to my attention. I'm glad to support them with my thoughts and my clinical experience and clinical material to help move this along.
That's very exciting. So where can people find you, Kelley? If they want to book a consult, they can go through Michelle.
Michelle Jackson is my coordinator. So we're here in Indianapolis at Meridian Plastic Surgeons. My office phone number is 317-575-0330. We're at 106th and Meridian Street, close to I-65. We're pretty easy to get to. Our address is 170 West 106th Street.
Thank you so much. So this is me with breast implants in versus breast implants out. I think you can see for yourself the dramatic difference in how toxic I look, how sick I look. It's absolutely amazing. I feel my energy levels have gone up so much, and I'm so grateful for having the second chance at life.